Welcome to the Parent Academy Real Talk. My name's Mary Beth Stapleton, Manager of Family and Community Partnerships for Harford County Public Schools. Today we're doing a real talk on the health in our learning support centers, the health of staff and students. With me today, I have Miss Mary Nasuta, who's the Supervisor of Health Services. Hi, Mary.
Good afternoon.
Good to see you. And Miss Katie Ridgway, our Supervisor of Risk Management. Katie?
Hi, Mary Beth. How are you today?
Doing well, thanks. And I have Ms. Lynda Boegner, who is our Acting Director of Clinical Health for the Harford County Health Department. Lynda, hi, thanks for joining us today.
Hi, everyone. Thanks, Mary Beth.
So to get us started, we thought it would be great to have Lynda give parents an update on what is the situation with COVID-19 in Harford County. I know we're hearing a lot in the media and in our circles of friends and family, but I think having one of our health experts talk to it would be a great thing to start with. So Lynda, could you just give us a quick update on what we're dealing with right now with COVID-19 in Harford County?
Sure, I'll be glad to do that. So I know if you've been following the news, a lot of the metrics that people are looking at has determined what stage we might join into reopening of schools. So one of the big metrics that we look at is number of new cases per 100,000 in Harford County and in Maryland and in the world. We take it at all different steps. And our numbers in Harford County are really good right now for that. We've also kind of looked at the number of deaths in Harford County. That has steadily been zero to in the last couple months we've had maybe 1 or 2 cases, so that's been trending down as well. And then we're looking at the positivity rate, very popular metric for the coming out of the governor's office as well as our Maryland Department of Health administrators, and that is right now, I think as of this morning, Harford County was at 3.62, which is well below the 5% that the governor kind of wants us to fall under. And then we're also looking at the hospitalizations per day, and that has definitely been trending down since we first started this in March when we started following this. So in general, Harford County numbers are really good. Always tell people to kind of be cautious with that, because as we're on the cusp here of stage 3 going into Friday evening per the governor's mandate, we do just want to be vigilant so that those numbers stay on the downtrend, because what happens in the community definitely impacts what happins in the schools. So we just want to keep an eye on that.
That's helpful. And just to clarify for that positivity rate, what that means is in a parent's view, it might not be clear at times. So the population that's being tested, of that population being tested, there's a certain percentage that is positive COVID-19. Is that correct?
The positivity actually is the number of positive cases over or divided by the number of tests that were done.
Okay.
So you definitely want to look at that number with all the other numbers too. I kind of like the new cases count. And I think Harford County as of yesterday was about 2,500 new cases. And that kind of gives us, I think, the best clue of what's going on.
Thanks for that update, Lynda. So thinking about with that information and knowing what we know now about our situation with COVID-19 in Harford County, Kate, can you give us an update on where we are with safety for our learning support centers, safety for staff and students?
Absolutely. Thanks, Mary Beth. So I hope everybody's had a chance to view our Learning Support Center safety video. It reviews all the safety protocols families, staff, students need to know in terms of making sure you're checking temperatures in the morning, making sure masks are worn and extras are sent to school, and all of the protocols that we will be following at the Learning Support Centers. The update is really how that translates at each and every school. So we've set up these protocols, we have worked with all the school principals, and we are working with the new Learning Support Center staff and people who have been assigned to the Learning Support Centers, and we're making sure that they're trained, and we're making sure that the school building itself is set up and ready for our learners. So that means removing desks in classrooms, putting floor markings on the floor for food service lines. It means identifying which bathrooms can be used and who's going to clean it and how often, and how are we going to rotate cohorts on playgrounds and all of those types of things. So the update is that we're all still working really hard to make sure that our learning centers are up and following all the protocols that we follow.
Wonderful, thank you. And it's good to know that someone like you is on top of that for us. So thanks, Katie. So Mary, thinking about, I'm going to turn to you with a question, thinking about the day-to-day for parents and thinking about the morning in particular as a mom of 4 children and one about to start high school in Harford County. I know that the day-to-day, especially the morning, when your child has symptoms of illness, you get a little nervous, right? You're like, uh-oh, and a regular school day during the regular school year. But now that we've got this, I think we have to kind of affirm that our child's healthy before we send them to the Learning Support Center. Is that right? How does that work? What should we do? Can you walk us through that as parents?
Certainly. As a mom, a proud mom of 2 graduates of Harford County Public Schools, I remember those mornings, and they can be very tough. So I know that a lot of planning will have to take place in families to get ready for in-person learning, and that parent acknowledgement letter really walks parents through the idea of not sending children to school if they're sick. And so right now, I remind everybody to go and purchase a thermometer. You will be taking temperature checks every day and looking for symptoms every day. If you're unsure, your child should stay home from school. And that I know is hard and it's going to be disruptive for many families. As we talk a little bit more about what the symptoms look like of COVID-like illness, it'll be a little more clear. But I just want everyone to know how important it is that we really keep those learning centers healthy. And the way that we do that is to make sure that people who are sick never enter the building. And that I know is going to be hard. It's going to be disruptive. And I ask parents, in addition to the thermometer, to have that plan B. What happens if your child wakes up, they have a fever, or they have some cough? And in a normal year, a cough would be like, it's this time of year. But for a COVID year, we know that cough is a real symptom that we have to watch for.
Okay, so cough, and then so just thinking about those symptoms, I know we've heard them, seen them, but as a school nurse, right, representing our school nurses, what are you thinking are those concerning symptoms as parents we really should keep them home and not at the learning center?
So we have sort of our big 4, and in any of these symptoms would be COVID-like illness, and a child should stay home from school and will be sent home from school if they exhibit them during the day. So they are that cough, which is just very indicative of COVID, also shortness of breath or difficulty breathing, or if they've had a new loss of taste or smell. Those are the top 4 symptoms that if you just have one of those, we consider that to be a COVID-like illness. Unfortunately, to complicate things just a little more, we also have sort of a pick 2 menu, where if you have 2 of these symptoms, you could also be considered to have a COVID-like illness. And so they are fever, and that's one that I know that parents are going to be checking for daily. In Harford County, we talk about a fever being 100, although you may see 100.4 other places. We're going to use our same parameter of 100. Fever, chills, muscle aches, sore throat, headache, nausea or vomiting, diarrhea, fatigue, congestion, or runny nose. That's a lot of symptoms that I'm sure your children have had before. Yeah. And it really just takes 2 of them to consider that to be a COVID-like illness. Now, with just one, just a sore throat or just a headache, that would not be considered to be COVID-like. We would treat it just like we do our regular protocols during the school year. But if they combine to be 2, or they're one of those top 4, they are COVID-like. So during the school day, and I will say we're really fortunate that in the learning centers, we will have a nurse in every single school. And that will be really encouraging, I know, for families. I know it's encouraging for me because they're great COVID point persons who can really tell us about the health of their community. But as children come to see the nurse, we will have to do what we call isolating and quarantining. I think we should probably define a few terms since we're talking about all these terms so much. Isolation is when we separate a person who has the virus. So we say, you're sick, you need to go and be by yourself, not with others. Quarantining is when we keep people who may have been in contact with someone who's sick away from others as well. It's another way to keep the community safe.
Okay, so thinking about that, first and foremost, so you've identified as a parent, you've identified there's a symptom, you need to keep them home. Should a parent contact anybody or tell anybody? Because I know as a parent, I'm going to call my pediatrician, right? I'm going to talk to my child's doctor to try to figure out what do we do. But in addition to that, are you expecting some kind of reach out to the Learning Support Center? from a
Yes,
parent?
we would absolutely love that if you believe your child has a COVID-like illness or has a positive test, especially.
Okay.
We do need to know that. We're keeping track of all of this data and we're sharing with the health department every morning. So we're going to be telling them about our attendance. We're going to be telling them about the number of kids that we isolated or had to quarantine during the day. So any information you can provide for us will be terrific. The learning centers are not as busy as the schools are. There are less kids in them. And this is a great way for us to keep our 6-foot distancing and follow all those CDC guidelines. But the more information we can have from families about the health of the community, the safer the learning centers will be.
Okay, so if you have a concern as a parent, and please reach out to the Learning Support Center, reach out to your teacher, well, probably your school principal.
Nurse, yes.
Nurse, okay.
Yep, school nurse.
And let them know what's going on.
Will be there the whole time the centers are open. There will be a nurse in attendance.
Okay, so for example, there is definitely COVID-like illness, right? And there is that child is, to Katie's point, participating with 8 other children in a learning support center classroom and 2 staff. So when that happens, if there is a symptom or there is a concern, what happens then? What kind of communication occurs between the health department, us, families? How does that all work? And I'm not sure who takes that. I guess, Mary, you take it first.
I'll start and then I'll send it to Lynda because we'll be calling her next.
Got it.
So the first thing that we're going to do is contact the parent to let them know that the child needs to be picked up immediately. Another part of our acknowledgement letter is that you do need to pick your child up right away. But one of the complicating factors is, as small as these cohorts are, they're going to be spending a lot of time together. And so these cohorts will be considered close contacts. Another definition, I just want to remind people what a close contact is. That's a person who has been within 6 feet distance for a period of at least 15 minutes to someone who has COVID-19 or a COVID-19-like illness. So we believe the cohort,
even if they're masked, right?
They're masked. Well, thank you so much for reminding me.
Well, because I'm just trying to think about that, right? So you're in a situation where you've had children together, but they're masked, and so you think, well, okay, that means they're okay, but they're not, right? You're just
That's right. That's right. That's true for any close contact. That it is irregardless whether wearing a mask or not. If you're within 6 feet for 15 minutes, you're considered a close contact. So I always tell people, if you don't want to be a close contact, back up, because that 6 feet gives us a lot of protection. But when we're talking about the cohort, we know they're spending a lot of time together and they will be considered close contacts. And this is really the part that may be very disruptive to parents and to sort of how we're going to deal with your daycare issues and childcare issues. When we have a child who has a COVID-like illness, that cohort is going to be quarantined. And that's going to be hard for families that those children will stay home for 14 days. And that's why we need that plan B of where are we going to go if we have trouble with a cohort not being able to come into school. I want to kind of give it to Lynda because Lynda's been dealing with this all summer long with our childcare.
So there's already experience in the community.
Yes, they have tons of experience. She shared it yesterday when we had our professional development with the nurses. So Lynda, tell us a little bit about that cohorting and quarantining.
Yes, and the key word here is it can be very disruptive, unfortunately, the way the guidelines are set up. But I think Mary hit it right on the nail there. When someone does have the COVID-like symptoms, they are considered, a presumptive case. So the child would be sent home and the cohort would be quarantined. There are a couple options, though, after that. So if the child is sent home sick, they could get the COVID test, and if it is positive, then we would have, we'd follow another algorithm for that. And if they were negative, that would actually bring the cohort back, which is a good thing. But there is that back and forth movement, kind of like a roller coaster ride. But that's something the daycares have gone through all summer long. Parents did kind of be shocked at that at first, but they have kind of fallen into a routine because everybody does want to keep their child safe. That's the bottom line. We want to keep the kids safe and consider their well-being as well. So people have been going in and out of school based on symptoms, but we do try to keep everybody in as much as possible.
So just to be clear, Lynda, on that whole process, so you have a child in your cohort that is the COVID-like symptoms, and that means everybody, including staff, have to be quarantined.
Correct.
That means they're at home for 2 weeks. Is that correct? 14 days?
They're home for 14 days, but there are options. So if the child that was sent home sick or the staff that was sent home sick, if they were able to get an alternative diagnosis, say strep throat or influenza, that is more the primary diagnosis, we could actually bring that cohort and that staff back sooner.
Okay, so to that point, it sounds like that communication back and forth between that parent and that school learning support center staff is really essential so that there's that ebb and flow. And it sounds like that's worked really well with daycare families throughout the summer, and that would be something we would be replicating. That's Correct. Good to know there's a plan. Very mm-hmm. good. But I think that's something that is really great that you're emphasizing for families, that it's not that they're COVID perhaps, but that they may have those symptoms. And that means that that whole cohort would need to quarantine. And that means that you would have to have a backup plan for childcare. Okay, very good. Well, that helps. Helps us understand the process.
Mary Beth, can I jump in here and just, I want to clarify something that's important to me from a safety standpoint, is we use this phrase close contact, and that is something that's defined for us. This is something that we follow from MDH, the Maryland Department of Health, and it's something that it is defined and given to us. All of our protocols we get from those sources. So this is not HCPS kind of making up that, we want to send everybody home or anything like that. It's that we're following the guidelines that we're given. And even though we're considering a cohort close contact, that doesn't mean we're going to allow all the students to have close contact during the day. We are going to work every possible scenario in keeping them 6 feet apart, in making sure they don't have shared materials, making sure that we're cleaning and sanitizing high-touch surfaces between cohorts and bathrooms and all of those things. And so even though we are considering that cohort a close contact, we're not behaving as if they're going to be in close contact all day and let them, share germs back and forth all day. We're not going to do that.
Thanks, Katie. That really does help. And thinking about that word, close contact, right? So the one thing that we're hearing about a lot as families is contact tracing. And I'm thinking Lynda would be the one to kind of start us off on that and what that looks like. And would that be something that would happen through the Learning Support Center if there's a concern of a COVID case? Like, how does that work?
So thank you for that. That's a great question. So the governor actually, probably a couple months ago now, set up the statewide COVID contact tracing system, and that's called COVID Link. So anybody that has tested positive so far to date might get a call from the Maryland state system, COVID Link. It'll show up as Maryland COVID on your caller ID. And there's also a phone number, 240-464-4488, that might show up on your caller ID. And we're really encouraging people to take that call, please, because it does assess a lot of symptoms and give us a lot of data so that we can learn from this situation and get us through. It's a huge scale program at that level, lots and lots of tracers every day calling all positive cases that have been acquired through lab testing. They are able to, the goal is to reach everybody within 24 hours, but because of the enormous amount of testing going on, that is a little bit later. And so sometimes the school might find out sooner, or sometimes the health department or the Maryland Department of Health might find out sooner too. But back to that the Maryland COVID system for just a second. It's a great system in theory. It allows families to get referrals to testing. It connects people to resources in the community. So it's a really useful tool. But I encourage families too to take that call, but also take the call from the school, because the school nurses, in collaboration with us, hopefully, will work together to kind of figure out who those exact close contacts were. So please take the call from the school nurse as well, because each of us have our own little perspective. School nurses definitely want to keep that school community safe and be sure to identify all the close contacts, because you guys are familiar with everybody. From the bus ride to the school to all their activities within the school. And then we kind of take a little bit broader perspective too, like just within the community. What is the positivity rates? What's the infectivity? All these pieces of information help us with that surveillance. So
Okay, well, that's good to know what that is, because sometimes we hear that and we're thinking, what is that? But we'll make sure we have that phone number up for families to be aware of as well. So before we close, I just want to give each one of you an opportunity to share any information that we haven't touched on, or do you think we've covered? And I'll start with you, Mary. Any closing thoughts or comments for families?
Well, I know these are really confusing and difficult times, and we appreciate all the partnerships we have with families. We love when you give us more information. We are available. The school nurses have been in schools for a couple weeks now, and they're ready to take your calls. I do want to remind families of a couple things. First of all, to really start a good pattern of behavior with your children, to start those routines again. I know how hard it is over the summer when we sort of get out of practice. So good nutrition, sleep, exercise, and stress reduction, all of that should be a part of every family's plan as we get back to school in whatever form it is. The other really important thing for us is that we need to get the message out that immunizations for vaccine preventable diseases are still required, whether in virtual classrooms or in our learning support centers. So we're especially worried about our kindergartners who will need a second measles, mumps, and rubella and a second varicella or chickenpox shot, and our kids going into grade 7 who need a Tdap and a meningitis shot. And so if you haven't made those appointments with your healthcare providers, please do. If you need help, the health department has some great clinics set up, and they are ready to help us out to get people vaccinated. So I do remind parents that this is a part of public health too. We certainly wouldn't want to have spread of a vaccine preventable disease when we have such terrific vaccines available. And another vaccine that you may want to consider that I think everyone should consider this year is an influenza or flu shot. We'll put some programs together and some resources for the kids in the learning support centers, and we'll work with the health department to provide some other clinics. But please think about doing that. We always say flu before boo, before Halloween, to get your flu shot. So Halloween's going to look so different this year. But these are things to think about. It's not just COVID that we're considering here. We're considering all of your health, and we're here to help you in any way we can to keep you and your family healthy.
That's wonderful. Thank you, Mary. And thank you for what you and your staff do. It's a huge effort, and we really support, we really appreciate your support. Katie, I'm going to turn to you. Any last minute? I know we've got that great video that you've offered for families around what safety looks like in the centers, but any additional thoughts for families?
Yeah, definitely check out the video, as well as a plea to work with your students on the proper way to wear a mask. So make sure that the mask is well fitted and it covers both the nose and the mouth and doesn't slide down kind of naturally. And so work with them on wearing that. Send in an extra one. Practice what social distancing or physical distancing or what 6 feet even means. Practice it, give visuals. The success of physical distancing and mask wearing really will impact the success of our learning support centers. And I just want everyone to know that we are monitoring the CDC, the Maryland Department of Health, the Maryland State Department of Education, national numbers, research. We're following all the guidelines that are set before us and really trying to make the best decisions that we can for our county. And we're also looking forward to taking all of this work that we're using for the learning support centers and thinking about what this means for in-person learning in the future. And so there are teams in place working on this, and it is something that we are constantly putting our time and energy towards.
Well, that's good to know. And I think that's good for families to know that we are planning forward, and that, HCPS together, learning forward, that's been our theme. Lynda, just a final thought around anything with the health department or anything we need to know from your perspective?
I just want to thank you all for letting us join this, because this is definitely a collaboration. We enjoy working with the schools, and we are here for the community, for the schools. Please ask any questions. We have a call center number that people can call, just our main office numbers. We're here to support the school nurses as well. And I just kind of want to echo what Katie said: masks on, social distancing, hand washing, all those things to keep you and your family safe.
Great. Well, thank you all so much for your guidance, for your support for families, and for being that resource that we need to get us through this challenging time, but we are going to get through it. So thanks again. And thank you everyone for joining us for the Parent Academy Real Talk. Stay well.